Question 1. A 65-year-old man has trouble breathing when active, difficulty breathing flat, and leg swelling. You hear an S3 heart sound. Which best explains the S3? A. Increased left ventricular compliance. B. Rapid ventricular filling due to high atrial pressure. C. Delayed closure of the aortic valve. D. Atrial contraction against a stiff ventricle. Answer B. Why B is correct. In early diastole, a high left atrial pressure forces blood very quickly into a still relaxed left ventricle. This sudden splash of volume causes vibrations in the ventricle wall, heard as the third heart sound S3. Why the others are wrong? A. If the ventricle were extra compliant, very stretchy, it would fill gently and not produce an S3. Can delayed aortic valve closure affects the second heart sound, S2, not S3. D. Atrial contraction against a stiff ventricle creates an S4 sound, which occurs just before S1. Question 2. Which hormonal change mainly raises preload? The volume of blood returning to the heart in chronic heart failure. A. Increased atrial natriuretic peptide, ANP. B. Activation of the renin-angiotensin-aldosterone system, RAAS. C. Increased release of nitric oxide. D. More atrial stretch receptors. Answer B. Why B is correct? RAS activation leads the kidneys to reabsorb sodium and water. This extra fluid expands blood volume, increasing the amount the heart must handle at the next beat, preload. Why the others are wrong? Upon ANP causes loss of sodium and water, which lowers blood volume and preload. C. Nitric oxide dilates veins, shifting blood away from the heart and reducing preload. D. More stretch receptors trigger ANP release. They do not themselves increase preload. Question 3. A patient with worsening left-sided failure develops fluid in the lungs. Which finding matches this fluid buildup? A. Elevated jugular vein pressure. B. Crackles at both lung bases. C. Enlarged liver. D. Swelling in the feet and ankles. Answer B. Why B is correct? Fluid leaking into the tiny air sacs, alveoli, causes crackling or rattling sounds, especially at the bottom of the lungs. Why the others are wrong? A. Jugular vein pressure reflects right heart or systemic venous pressure, not lung fluid. C. An enlarged liver is a sign of chronic right heart backup, not acute lung fluid. D. Leg swelling shows systemic congestion over time, not sudden pulmonary edema. Question 4. Which medication lowers death rates in patients with reduced ejection fraction heart failure? A. Furosemide. B. Spironolactone. C. Digoxin. D. Hydrochlorothiazide. Answer B. Why B is correct. Spironolactone blocks aldosterone, preventing harmful remodeling of heart muscle and reducing hospitalizations and mortality. Why the others are wrong? A. Furosemide relieves fluid overload but has not been shown to extend life. Digoxin can improve symptoms and reduce hospital visits but does not decrease overall mortality. D. Thiazide diuretics help with mild swelling but offer no proven survival benefit. Question 5. A 72-year-old woman's BNP is 800 pg-L, normal 100. What does a high BNP indicate? A. Heart muscle ischemia. B. Too much fluid stretching the heart chambers. C. Pulmonary embolism. D. Dehydration. Answer B. Why B is correct? BNP is released by stretched heart muscle cells when they sense excess fluid volume. A level that high clearly signals volume overload. Now, why the others are wrong? A. Ischemia may raise BNP slightly, but not to this degree. Key. A. Clot in the lungs can raise pressure, but usually not elevate BNP this much. D. Dehydration shrinks blood volume and lowers BNP. Question 6. A 58-year-old woman on lisinopril develops angioedema. Which step maintains survival benefit without this side effect? A. Switch to losartan. B. Add hydralazine with isosorbide dinitrate. C. Start spironolactone. D. Begin digoxin. Answer A. Why A is correct. Losartan is an angiotensin receptor blocker, IARB. It provides the same RIAS inhibition as an ACE inhibitor, but does not raise bradykinin, so it avoids angioedema. Why the others are wrong. B. Hydralazine nitrate is a backup if ARBs also fail. C. Spironolactone adds benefit, but does not replace RAS blockade. D. Digoxin improves symptoms, but has no survival benefit. Question 7. A 62-year-old black man on AC inhibitor and beta blocker remains symptomatic. What additional treatment improves survival specifically in black patients? A. Ivabradine. B. Hydralazine plus isosorbide dinitrate. C. Sacubitril valsartan. D. Spironolactone. Answer B. Why B is correct. Clinical trials show that adding hydralazine with isosorbide dinitrate further cuts mortality in black patients already on standard therapy. Why the others are wrong. Ivabradine lowers hospitalizations but has a limited effect on death rates. Sacubitril valsartan improves survival in all patients but does not target the specific benefit demonstrated in black subgroups. Spironolactone reduces mortality generally but is not uniquely proven in black patients. Question 8. A 70-year-old woman with EF 25% and left bundle branch block, QS 160 mz remains in class 3. Which device therapy is indicated? A. Implantable cardioverter defibrillator ICD alone. B. Cardiac resynchronization therapy CRT. C. Left ventricular assist device LVAD. D. Permanent pacemaker. Answer B. Why B is correct. CRT paces both ventricles together to correct the abnormal electrical delay caused by the bundle branch block. This improves coordination of contraction and alleviates symptoms. Why the others are wrong. So, ICD prevents sudden arrhythmic death but does not fix the timing mismatch. LVAD is reserved for end-stage heart failure or transplant candidates. D. A single-chamber pacemaker cannot synchronize both ventricles. Question 9. A chronic heart failure patient has low sodium, 128 mcRAL. What does this mean? A. Effective fluid removal. B. Poor prognosis. C. Dehydration. D. High cardiac output. Answer B. Why B is correct? Hyponatremia in heart failure reflects excessive water retention driven by strong hormone activation. It signals more severe disease and a higher risk of complications. Why the others are wrong? A. Successful diuresis usually normalizes or raises sodium levels. Ka. Dehydration concentrates sodium, causing hypernatremia, not hyponatremia. D. High output states rarely produce dilutional hyponatremia. Question 10. A Swan-Ganz catheter shows a pulmonary capillary wedge pressure (PCWP) of 28 mmHg, normal 6 to 12. What does this high PCWP indicate? A. Elevated left atrial pressure and lung congestion. B. Increased pressure against the right ventricle. C. Low systemic vascular resistance. D. Isolated right sided failure. Answer arm. YA is correct. F. PCWP measures pressure downstream of the left atrium. A high value confirms that left heart pressures are elevated, causing fluid to back up into the lungs. Why the others are wrong? B. Right ventricular afterload is reflected in pulmonary artery pressure, not wedge pressure. Sa. If systemic resistance were low, wedge pressure would likely drop if filling pressures were normal. Da. Right sided failure alone shows normal wedge pressure, but elevated systemic venous pressure. Don't forget to like this video if it helped you, subscribe, and hit the bell icon for more high yield nursing exam content. Comment below with your toughest nursing question. We'll cover it in the next video.